Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How to know if you have walking pneumonia. Walking pneumonia is a non-medical term for an atypical, mild form of pneumonia that can feel much like the common cold. The main difference between pneumonia and walking pneumonia is the severity of symptoms. /r/n/r/n Most people with walking pneumonia can continue functioning normally without staying in bed or going to the hospital. Symptoms can be so mild that you don't realize you're sick. /r/n/r/n/Kseniya Ovchinnikova Getty Imagesrnrn Pneumonia can be caused by various bacteria, viruses, and other microorganisms. Walking pneumonia is typically caused by a bacterium called Mycoplasma pneumonia. Anyone can get it, but it tends to infect children ages 5 to 17 and people younger than 40, especially when living or working in crowded conditions. /r/n/r/n Walking pneumonia is more common among people with an underlying obstructive airway disease such as bronchial asthma or chronic obstructive pulmonary disease, COPD. You're also at higher risk if you're recovering from a respiratory illness or have a weakened immune system. /r/n/r/n It can take as long as 4 weeks after exposure for symptoms to appear, and some people show no symptoms at all. Symptoms start gradually, perhaps with a tickle in the throat or a mild cough. As the name suggests, people with walking pneumonia can usually carry on with their everyday activities, though symptoms can include /r/n/r/n Symptoms typically improve within 3 to 5 days, but the cough can linger for weeks or months. Recovery times vary and may be longer if you have underlying conditions such as asthma or COPD. /r/n/r/n Most cases of walking pneumonia are mild. However, if you have cold-like symptoms that become more severe or last more than 1 to 2 weeks, such as a persistent cough, fever, breathing difficulty, or fatigue, you should seek further evaluation from a healthcare provider. /r/n/r/n Even though symptoms are mild, walking pneumonia is still a serious illness. It's not common, but Mycoplasma pneumoniae infections can make certain conditions worse or lead to complications such as /r/n/r/n Yes. It spreads through respiratory droplets when an infected person coughs or sneezes and others breathe it in. You can also pick it up when you touch a contaminated surface and your face. It spreads in places where people are in close, prolonged contact, such as schools, community centers, hospitals, long-term care settings, and residence or detention centers. /r/n/r/n Walking pneumonia is contagious from incubation until symptoms end, usually about 2 to 4 weeks. /r/n/r/n Viruses, fungi, and bacteria cause pneumonia. Walking pneumonia is almost always caused by a bacterium called Mycoplasma pneumoniae, a common cause of respiratory illness that can damage the throat, windpipe, and lungs. It spreads from person to person in respiratory droplets. /r/n/r/n Go to an emergency room or call 911 for symptoms such as /r/n/r/n Consult with a healthcare provider for symptoms of pneumonia, especially if you're at risk of severe disease due to an underlying health condition. During a physical exam, your provider will use a stethoscope to listen to your lungs. Walking pneumonia usually causes crackling sounds when you breathe. Other diagnostic testing may include /r/n/r/n Walking pneumonia often resolves on its own, but treatment may include /r/n/r/n much as you would do for the common cold or other respiratory illnesses. Self-care tips for walking pneumonia include /r/n/r/n While there are several types of pneumonia vaccines, there's no vaccine to prevent Mycoplasma pneumoniae infection. If you're sick, you can help cut down the chances of spreading it by /r/n/r/n Avoid prolonged close contact with someone who is sick to lower your chances of becoming infected. If you must be around someone coughing or sneezing, Wear a mask and wash your hands often. Speak with a healthcare provider about staying current with vaccines for respiratory illnesses. /r/n/r/n Yes. Having had the infection does not give complete immunity. You can have it multiple times. /r/n/r/n Walk-in pneumonia is a term for atypical, mild pneumonia. It's usually caused by a bacterium called Mycoplasma pneumoniae. Most people who have it can function without staying in bed or going to the hospital. It may resolve on its own, but even mild pneumonia is a serious illness. That's why it's best to see a healthcare provider for diagnosis and treatment. /r/n/r/n Treatment may include antibiotics and over-the-counter medicines. Getting plenty of fluids and extra rest can also help you recover faster. You can help prevent the spread of the virus by avoiding crowded settings, covering your mouth and nose when coughing or sneezing, and washing your hands often. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.